everyone, and welcome back to another episode of Inside Dentistry, your go to series for real, unfiltered journeys of international dentists navigating the US dental world. I'm your host, Dr. Asta Vass, and today we have someone truly inspiring joining us. Please welcome Dr. Amanda Vicari, a Venezuelan dentist who's currently specializing in periodontics and implantology at the University of Illinois at Chicago. She earned her dental degree in 2019 in Bogota, Colombia, and completed the AEGD program at the University of Florida in 2024. And for all the international dentists tuning in, she's also the powerhouse behind the 123 INBDE, a platform helping foreign trained dentists prepare for the INBDE and navigate the revalidation journey in the US. Amanda, thank you so much for being here today. We are so excited to have you.
Thank you so much for having me. Thank you for that introduction. I'm very happy to be here. I'm very happy to be sharing with fellow international dentists. And I want to congratulate you on having this platform because, as an international dentist that has been throughout this journey, this really matters. And this is invaluable for us international dentists when we're trying to find out different pathways, information on the internet that, as we know, there's a lot of information. So thank you for having me and for having this platform that's very useful for all international dentists.
Of course, and I'm glad to finally have this meeting with you. I know it's been a long time since we've been trying to schedule this together, so I'm really happy that we're doing this today. And let's get started by going back to where this whole thing began, right? So, like, can you tell us about your journey? What brought you to United States to pursue dentistry?
So it's a very interesting and long journey. I feel like now, after almost, I feel like 5 years since I've started this journey.
Okay.
So, as you explained in the introduction, I am from Venezuela.
Yeah.
But a fun fact about me is that I was born here in the United States
Okay.
while my father was doing an oral surgery residency. So,
Oh, nice. Okay.
yes. So, I've always said that I was like born into dentistry in a literal way. And I've always felt that connection with the United States because also my father did his residency here. So we always talked about that.
Okay.
Then I grew up in Venezuela. Then I went and did dental school in Colombia. And while I was doing dental school, I always discussed with my dad about coming to the United States, like the possibilities, what type of programs there were, where I wanted to study. But it was very overwhelming for me. I remember in the beginning, I was like, there's so much information out there, but you don't really know what's the best option for you. So that's when I kind of like hit pause in, coming to the United States. But then, you know, things in life happened. My dad passed away, and that made me like kind of reorganize my life and set my priorities to what I really wanted to do. And I realized I really wanted to come to the United States. So that was in 2020, basically. So I started studying for the boards, but then COVID hit. And then
Yeah.
they changed the NBDE Part 1 and the NBDE Part 2 to the
Mhm.
IMBD. So I
Yeah.
remember when they put that out there. I was like, I don't know what to do. Like this new exam, everyone's going crazy.
Yeah.
Everyone was telling me like, do the NBD part one, part two, because it's gonna be horrible. But then I kind of reevaluated my options and I said, I am going to go for the IMBD no matter what. It doesn't matter if I'm like the first person to take it, I do it. And that's when I started sharing my journey through social media as well. So that's why I'm telling you, like, these platforms really matter because people
Yeah.
find very useful information here. And I started sharing my journey, and that's when I created my company, 123 IMBDE.
Mhm.
And then we created a course to study for the IMBDE. I passed the IMBDE. Then, I applied to the programs that I think we're going to talk about that a little bit later. Um,
Yeah.
and then here we are now living in Chicago, Florida, now Chicago. So multiple places.
Oh, nice. I just spent the Memorial Weekend visiting Chicago, and it's a beautiful city. So yeah, and the entire journey you've been talking so far, it's been so hard for you, and it is somewhat relatable for a lot of us who are foreign trained dentists. And I know that a lot of our audience are in that same early stage. And now many foreign dentists ask, should I go for DDS? Should I try specialty? Or maybe an AEGD program. So, what drew you to the AEGD program specifically as opposed to applying directly to DDS or specialty program?
So I don't know if you know this about me, but I was like a recent grad when I started applying to the program. So my curriculum was not good.
Yeah.
Like I did not have an ideal curriculum. I really didn't do research in my university. Like I was part of like some research projects, but no publications at all. I was recently grad, so I didn't have a lot of experience in the dental field. So I didn't have like the best odds in
Yeah.
regards to applying, right?
Hmm.
Like comparing to what everyone says and what you read on the
Yeah.
internet. So I was very open in regards to the types of programs that I applied to. So I basically applied to all general dentistry programs. So I applied
Mhm.
to advanced standing programs that first cycle that I applied. And I also applied to AEGDs and GPRs, which are
Okay.
postgrad
Yeah.
general dentistry programs. So, what I really wanted was to do a general dentistry program first because I wanted to do a surgical residency, but I wasn't 100% sure at
Mhm.
that time what I wanted, either OMFS or perio. So I
Okay.
really didn't know what I wanted. So I decided to, you know what, I'm gonna actually do and do general dentistry and see what I actually like. So that's why I applied to general dentistry programs first. But comparing both programs, I got into NYU Advanced Standing Program.
Okay.
But then a lot of things happened, and I met my husband.
Mhm.
One of my goals was to be able to practice in Florida.
Okay.
And I really wanted a program that took me out of my comfort zone in regards to what I do. So no program is better than the other. That's something
Yeah.
that you have to say. The best program is the program that gets you to your goal. And you're gonna learn it in every single program. But in my case, I wanted a program that was very clinical, like heavy, heavy clinical. And
Mhm.
that's why I opted for an AEGD instead of an advanced standing program in the end.
Okay. That
Mhm.
makes a lot of sense. And even the way you put it up, it's important to get to your goal through a program, and it's great to hear how you saw AGD as your stepping stone. So, what was your AGD experience like at University of Florida? And were there any standout moments like procedures or clinical exposure that really made an impression on you?
So I loved my AEGD at the University of Florida because it was truly a comprehensive approach to
Okay.
dentistry. We saw very complex cases because we were like a community center. So we received like all of the patients that could not be seen in other clinics.
Okay.
So we saw very complex cases, very complex patients, and a lot of things that I really enjoyed about the AGD, especially at the University of Florida, was that I was the youngest out of my group. So we were
Mhm.
12 in my
Okay.
year. We were all international dentists in this
Okay.
program.
Wow. Okay.
So yeah, it's really nice. So all of my co-residents are my friends, they're my family
Mhm.
now. But what I enjoyed the most was that in the beginning, I was very afraid because I haven't been in the clinic for so long and I
Yeah.
didn't have a lot of experience. And normally for an AGD, what they look for
Mhm.
in a candidate regularly is someone with experience that can perform a lot of clinical procedures, right?
Yeah.
So in the beginning, I remember what you were saying, like a highlight that I remember, like one of my first cases was like a full mouth rehabilitation. And I remember that I saw the patient and I was so overwhelmed, like with the amount of things that were going on, like periapical lesions, like we
Yeah.
had to endo, implant placement, like perio, crown lengthening, like full mouth rehabilitation, veneers, crowns, like everything. And I remember standing up from the chair and literally going to one of my faculty and telling him like I don't know what I'm looking at. Like I don't even know where to begin with.
Yeah.
So it was very, very nourishing for me because I learned from all of my co-residents
Yeah.
and of course of my faculty, but most of my co-residents were already specialists in their country. So everyone had a
Yeah.
background of being an orthodontist, a periodontist, a prosthodontist. So
Mhm.
I always joke that my co-residents were also my faculty. And I truly learned how to see cases in a comprehensive approach, like not
Yeah.
as tunnel vision, that as sometimes you can
Yeah.
do. So yeah, it was a great experience, and I think that was my foundation for in the future becoming a great specialist. So that was my goal with the AEGD.
Okay. And how long was this program for?
So this is an unconventional program. This
Okay.
is a 2 year
Okay.
AEGD. So normally for revalidation purposes,
Okay.
most of the states require for the program to be at least 2 years, consecutive
Okay.
years. Some states do accept 1 year programs, AEGDs or GPRs, but normally it's 2 consecutive years in order to
Okay.
be valid. Mhm.
Okay. I love that. It sounds like it gave you a ton of hands-on experience. And now, for those watching who are building their own application, what advice would you give on creating a strong AGD application? Are there any specific qualities or experiences programs are looking really for?
I feel like this is a myth that has been going around like for, the longest time. I always say that truly we don't know exactly what the programs are looking for. The only people that know exactly what they're looking for are the program directors and the programs, and that can change year per year.
Yeah.
So anyone that tells you you need this and this and this, it's not their reality because each program is looking for a different type of candidate. Each
Yeah.
university has its own goals, mission, and vision that they follow, and they look for that into the applicants. So my best recommendation is to portray yourself as the most coherent and best way that you can. Meaning, for example, in my experience, I didn't have any research, I didn't have any dental related experiences, like not a lot. So, what I tried to do was try to strengthen everything that I had already and make
Okay.
it like more cohesive and try to kind of like venture out into things that I actually enjoyed because a very common mistake that applicants make is that whenever someone reads your application, it's not coherent between what you say you like and what you said
Yeah.
you've done or you want to do. So, for example, if you're applying to an AEGD, you have to be someone that likes or wants to learn about absolutely everything in general dentistry. So, if they see
Okay.
you're a very like narrow or very focused CV
Mm-hmm.
or experiences, for example, perio, only perio, shadowing a periodontist, doing
Yeah.
observership in a perio program, but you're applying to an AGD. To the person that's reading that, it's not very cohesive what you're
Yeah.
saying that you like and what you're demonstrating that you have done and want to do.
Okay.
So being yourself, but trying to portray the best image of yourself that you can.
Mhm.
Of course, being truthful and also being truthful to what you actually like and demonstrating that in your application.
Okay. And did you get to do research projects as well during this 2-year program?
So during my AGD, no, it was
Okay.
encouraged, but it was not the
Requirement per se.
approach. It was
Okay.
not a requirement, but it's all we did have some subjects in regards to research and evidence-based dentistry,
Okay.
but you were not required to publish an article or do a publication. Um, I think because an AGD is more so towards the clinical aspect and not so much related to
Academy.
academia 100%.
Yeah.
So
Okay.
it's a different approach. But yeah,
Okay.
we weren't required to publish.
Okay, that is insightful and also great advice. So here's a common question we hear all the time, right? Like, how does completing an AGD help you with US licensure? And are there any certain states where AGD alone is enough without a DDS? Do you have anything to say about that?
Yes, of course. So some people think that, as we know, if you do an advanced standing program, you can basically practice anywhere you would like. You
Yeah.
have met the educational requirement. Then after you graduate from your program, you do have to do some additional requirements like tests, different tests, the ADEX or the CDCA, depending on the state that you're in.
Yeah.
Um, but some people think that because you do, for example, AEGDs or GPRs or specialty programs, you are limited to certain states where you can practice. But in reality, I don't see it as something that's limiting. It just what aligns to where you want to live. And if that
Okay.
works for you, then that's great. For example, some states where you can practice after doing an AGD of 2 years is Illinois, Florida, Michigan, and other multiple states.
Okay.
So you do have that opportunity to practice in different states. So, for example, my personal recommendation, if you're like in between programs and you're not sure what you want to do, if you want something that gives you more freedom in regards to you literally don't know where you're gonna live, I would do an advanced standing program.
Yeah.
Or if you're looking into going into oral maxillofacial surgery, because most of the programs require a DDS.
Yeah.
On the other hand, if you really like a more heavy clinical approach, and the states where you can practice are states that you would like to live in, then 100% I would go for an AGD. In my case, I wanted to live in Florida, practice in Florida, and have other options, but that was my main goal and
Okay.
also the clinical aspect. So that's why I chose AEGD.
Okay, that's such helpful information, and especially for those who are like wanting to practice sooner. Now, before we jump into specialization journey, I wanted to spotlight something on how you're helping so many of the people with I-123 INBDE. So, can you share what inspired you to create this, and how has it been helping international dentists to prepare for the INBDE?
Yes, so I'm very proud of what we've built because in the past 5 years, we've had this company for 5 years, and we've had 18 courses that we do.
Okay.
18 different editions of our course that's called IMBD Pro, which is a course mainly for Hispanic or Latin dentists in
Mhm.
Spanish specifically because there's a barrier in regards to the language.
Okay.
So we help foreign dentists to basically understand what the IMBD is because, as you may know, it's not only understanding the subjects that are going for the exam, but it's also understanding the American system, the protocols, the way that they ask the questions, and different things, and also being part of a community that supports you throughout this journey because there's nothing more encouraging than being around people that are throughout the same journey. So we also offer one-on-one consulting in
Okay.
regards to the whole revalidation process to see what's the best fit for you because there's a lot of information out there and other different products that we offer. But we do have like a lot of information in our Instagram if you would like to follow us. It's at 123. I don't know how to say that in English, but the lower dash
Yeah, underscore, I think, is what it said.
underscore. Yes,
Yeah.
underscore. You got it. 123 underscore IMBD if you would
IMBDE.
like to follow us. Mhm.
Well, this is very valuable for a lot of people, and you explain things so clearly. It's definitely motivating to see a fellow international dentist giving back like that. So, for those people who are listening to us, if you're prepping for the INBDE, drop a message. I will pass the INBDE in the comment section, and make sure you follow us on Instagram. So, now talking about the exciting next step you took, specialization. And at what point during or after AGDE did you realize you wanted to specialize? And what drew you to periodontics in particular?
So, this is actually a funny story because I always wanted to be an oral maxillofacial surgeon when I was
Okay.
younger because my dad was an oral surgeon.
Yeah.
But in Venezuela, where I'm from, specialties are different. Like periodontics is viewed differently in the United States and in Venezuela in regards to the procedures that they normally perform.
Okay.
So I never considered perio because I was like with my father, but he practiced in a private practice, so he didn't do a lot of like trauma or things like that
Yeah.
type. He did a lot of implant placements, graftings, PRF. Like he did a lot of actually like perio procedures, right? But I grew up with that, mentality, and then when he passed away, I started to rethink and actually start to think more about if this is what I really want or what I thought I've wanted throughout my
Yeah.
life, right? So I took kind of like a step back, and that's when I decided to be like, okay, so let me first practice general dentistry and do general dentistry and actually see what I like and what I am really good at. And then if I want to specialize, then I'll do that. If not, then no pressure. I will be happy as a general dentist. And that was my mindset when I got into the AEGD. Then for the first year, I was like so overwhelmed with everything that I was learning that like being a specialist didn't even cross my mind because I was basically surviving in the AGD in a good way, but
Yeah.
surviving. And then when I started second year, I met a periodontist and I had a lot of faculty that were periodontists and practiced in Florida. And I started to work with them with really complex cases, doing implant placements, doing
Mhm.
full arch crown lengthenings, bone grafting, socket preservation, and procedures like perio, true perio procedures, osteosurgery, and things like that. And then a switch like turned on in my mind, and I was like, like my personality, I always say this, like there's different personalities in regards to either you specialize or you don't, and there's not like a right or wrong answer. But for me, I wanted to be like a master in an area, like in a
Yeah.
specific area, because with an AGD, you do a lot and you practice a lot, but in reality, when you go out of the AEGD, there's a lot of liability and a lot of things that the more you
Mhm.
know, the more you realize you don't know. So
Yeah.
I started to think like, okay, so I really want to specialize and be a master in a topic, in an area, and really understand like the fundamentals and the theory behind everything that I do. Not that you don't do it in the AGD, but it's heavily clinical. So it's a different approach.
Yeah.
So that's when I started to apply during my second year to the AGDs to Perio. And that's basically when my journey to specialization began.
Wow, that's really well said. And I think I love that pink and white aesthetics really also resonates with me. So it's good to understand your journey and how you picked up. And I also want to say my condolences for your dad as
Thank you.
well. I'm sure it gives you more power to deciding what you wanted to specialize. And of course, he led you to what you want to be.
Yes.
So what made you choose University of Illinois, Chicago for the Perio program? Was there something about the curriculum or, the clinical or the faculty that really clicked for you?
Yes. So when I started applying to the programs, my mindset was, I've already lived in Florida. The most like the high, there's a high probability that I will come back to Florida and live in Florida. You never know where life will take you.
Yeah,
It's something
true.
I've learned, but you have your goals and things you have
Yeah,
like in mind. So, I got married, and with my husband, we decided, okay, so let's live somewhere else for a few years and have this experience, both of us. And also I wanted to learn. I am Latin American, right? And in Florida, University of Florida, of course, everything is in the United
yeah,
States, but there's a lot of Latin influence, which is great and you feel
yeah,
very comfortable in. But at the same time, I wanted to also be immersed in another type of schooling, in another
yeah,
type of vision, in another type of different approaches. I wanted to kind
yeah,
of like mix and match and get the best out of all of the worlds and different schoolings that I've had and live in another city for a few years while I'm young, while I don't have a
yeah.
family, while I can move, and we had that flexibility. So also, I only applied to programs for specialty that paid a stipend.
Okay.
So that was something that was also one of my filters for applying.
Hmm.
And another thing, also going back to my father, I used to come a lot to Chicago because he used to lecture a lot here in
Okay.
symposiums and conferences. So I really enjoyed the city. So when I was looking at the different programs, I saw that there was a program at the University of Illinois in Chicago. And I also know a friend that was doing the program in past years, and they
Okay.
said that it was very, very heavy clinical
Okay.
because there was not another post-grad university that offered specialties in dentistry because we used to have Northwestern for
Okay.
specialties, but they closed the specialties in dentistry. So there's only the University of Illinois in Chicago. So all of the
Right.
patients come to us. So there's a lot of patients, a
Yeah.
lot of procedures, and that's mainly what brought me to UIC.
That's a solid strategy, and I think a lot of our viewers will definitely take notes on that. So, how do you think your AGD experience helped you prepare for the clinical and academic challenges of peri-residency?
I always say this, by me doing the AEGD, that opened up the world for me. Like
Okay.
it's not a requirement to apply for applying to a specialty, but in my opinion, like doing an AEGD for me, it's gonna make me a great specialist in regards to not having tunnel vision. So for example,
Yeah.
now I see patients and I see everything. Like I don't focus on perio only. I see the patient as a comprehensive approach, and that's something that my AEGD gave me because we did all of the procedures. So it's not that I'm going to do those procedures, but the fact of knowing how it's done, why it's done, when it should be done, when it should be referred, and knowing my limitations in regards to what I can do for the patient and the possibilities as well. So that
Yeah.
opened a whole world for me, and it truly made me a better dentist. It made me a better person. It made me, and it's gonna make me a better periodontist. So I am deeply grateful for doing the AGD because I am one person before doing that and after
Yeah.
doing that.
Right, and I think having that extra year of US clinical exposure can be such a confidence boost for sure. So let's zoom in your life right now. So what does a typical day look like for you as a periodontic resident at UIC? And are you mostly in the clinic, lab, or like doing lectures? So what's it like?
So it depends on the year. So for
Okay.
example, when you another thing that I really like about UIC is that it's a very work-life balance focused university.
Okay.
So you really get to live like a very healthy and happy outside life, have your hobbies. We basically get out of clinic at 4:35 p.m., like
Okay.
4:30 or 5 p.m. So depending on the year, so the first year you get the first semesters, it's basically classes, and then you start the clinic. So you have like intro to perio, you have a lot of basics reviewed in regards to periodontics, and we also do critical literature review and
Okay.
current literature review. So we do article reviews every single week. But another thing about UIC that really drew me to the university that I didn't mention before was that some specialties, it's not mandatory to have a master's degree, like when you
Okay.
graduate. So you can either do just a specialty, which is going to give you a certificate in advanced graduate studies. That's the title that you get.
Okay.
And you have the option on most programs to do as well a master's in oral health or whatever you decide.
Yeah.
My program, it's mandatory to do both. So I'm basically
Okay.
doing two programs at the same time because
Oh, wow.
they're different subjects.
Okay.
So we graduate with a certificate in perio, but also a master's degree.
Okay.
So
Master's degree in oral health.
oral health, yes,
Okay.
and biology. So
Okay.
it's a lot, but in second year, you start seeing this master's classes
Okay.
for the master's degree. So it's mostly clinic. It's very, very like heavy clinical, but we do have a lot of classes. Like, for example, Monday mornings are mostly classes, and then during lunch or before clinic,
Okay.
so 7:30 to 8:30 or during lunch. So yeah, but it's mainly we're basically all day in the clinic. And it's very, very heavily clinical. And we also get to work a lot with other departments, other specialties.
Okay.
So we get assigned co-residents in different specialties. So that I love. So I've worked a lot with ortho, with pros, with endo, and we refer between each other because everything is in the same university, in the same building. So it's great. You can literally just walk up to endo,
Yeah.
be like, hey, I have a question. I have this patient
Yeah.
and discuss the cases. So I've loved that interdisciplinary approach.
Wow, that sounds intense and fulfilling at the same time. So you mentioned that you are doing two programs at the same time. So how long is your duration of the program since you're doing two of them?
It's 3 years in total.
Okay. So
Both programs during those 3 years.
oh wow. Okay, so like you have the exams separately for both, or do you do it like together with Perio?
Different. It's you have
Okay.
different exams for both programs, so it's like
Okay.
kind of like living two lives, two separate lives. But
Yeah.
it integrates a lot because we see it with the other specialties, the ones that do the master's degree.
Yeah.
Um, and it's very like immersed into your schedule. So they make it very easy, to accomplish both programs.
Okay. And any final advice for international dentists who are still figuring it out, if they want to do an AEGD, go for a DDS, or head straight to a specialty like perio?
First of all, I would say define what your life goals are. So,
Yeah.
where you want to live, if you have somewhere you would like to live, or the possibility of where you can live, like if you have family, if you have friends, where you feel you're going to be happiest, because in the end, it doesn't matter what you do. The most important thing is what makes you happy, independently of what other people do. So, don't do a program because other people are doing that program and that's what you read. Do it because that's truly what you want to do and that's where you want to go and where you want to live. So that's my first advice. My second advice would be to don't be, on the contrary, be very open in regards to applying because your mindset is going to change a lot throughout applications. For example, the
True.
more you learn about the programs, the more you learn about the reality of each program and each university, the more you're going to be grateful for that you have multiple options that you apply to. So apply
True.
to as many programs as you can that align with your goals and as you can financially compromise.
Yeah.
And then, life is basically going to decide for you in regards to which programs call you, to which programs you interview with, et cetera, et cetera. And another tip that I would give to you is that once you get into the program, you're gonna suffer imposter syndrome 100%. You're gonna be like, I fought so hard to be here, but I feel like I don't know this or don't know that. And always remember why you started. If you always remember that, even though you get any obstacles or have any tough situations throughout your life or this journey, the people that make it are not the most intelligent people. We are not like millionaires. We're not,
Mhm.
like geniuses. We are very perseverant and resilient people. So that is like the most important qualities, or those are the most important qualities that you have to have. If you get a no from a university, see that as redirection, not rejection. It doesn't mean that you're not going to get in, maybe not now, maybe in the
Yeah.
future, and it has a reason why that happened the way it happened. So take advantage of that, learn the most that you can, and be open to new possibilities.
Yeah, and Dr. Amanda, thank you so much for sharing your path today and being so honest and real, with detailed information. So, from your INBD journey to your AGD and now your periodontic residency, you're the proof that there are many roads to success in dentistry for sure. And to everyone watching, if you want more guidance on INBDE, make sure you follow 123 INBDE on Instagram and support this amazing platform. And if you found this conversation helpful, don't forget to like, share, and subscribe to our YouTube channel on Dental Student Society. Any final words, Doctor, before we just finish this session?
Thank you so much for this platform again. It's truly valuable. And I really enjoyed this conversation. I hope this was helpful
Yeah.
for the people that were watching. And if you also have any questions or just want to see a daily, what goes on in a life of an international dentist, you can also follow me on Dr. Amanda Vicari, my name.
Yeah.
And yeah, believe in yourselves, work hard, and don't get discouraged. And thank you so much for having me.
Of course. Thank you so much for joining us today, Dr. Amanda, and I hope you have a great week.
Same.
All right. Bye
Bye,
bye.
everyone. Thank you.